Obese patients could be refused surgery for up to a year as part of efforts to save money, an NHS commissioning group in North Yorkshire has said. Officials at the Vale of York Clinical Commissioning Group said the decision came at a time when the local system was under severe pressure. But NHS England said it was asking for the plans to be reviewed to make sure they are proportionate and reasonable. It can intervene because the CCG is under special measures. The move would see a ban on, for example, hip and knee operations, with the restrictions applying to patients with a body mass index of 30 or above, which indicates obesity, as well as smokers. If, however, the patient can shed 10% of their weight, they could be referred within the year. The new rules would only apply to elective surgery for non-life-threatening conditions. September 3, 2016, 12:26 Greenwich Mean Time. 406. 3. All social. Shares, 409. Print. Send feedback. No blanket bans. But a spokesman for NHS England said, reducing obesity and cutting smoking not only benefits patients, but saves the NHS and taxpayers millions of pounds. This does not and cannot mean blanket bans on particular patients such as smokers getting operations, which would be inconsistent with the NHS constitution. Vale of York CCG is currently under special measures legal direction, and NHS England is today asking it to review its proposed approach before it takes effect to ensure it is proportionate, clinically reasonable, and consistent with applicable national clinical guidelines. Chris Hobson, the head of NHS providers representing acute care, ambulance and community services, said it was a real worry that a number of decisions like this had been made. NHS bosses now believe they had reached the point at which the health service was simply being asked to deliver too much for the funding that was available, he told BBC Radio 4's Today programme. He said rather than commissioning groups making piecemeal decisions, there should be a national debate about the future of the healthcare system. Shaw Summers, a bariatric surgeon based in Portsmouth, said it was a fairly logical step to save money, but was short-term and discriminatory. Obesity is an illness, and for these people, they are not deliberately waking up each morning thinking, "How do I stay fat?" He told the Today programme. They are trying to lose weight in the vast majority of cases and to deny them treatment that they need on the basis of their weight, without then offering them effective help to help them lose weight is rather like discriminating against a segment of the population on the basis of their color or religious persuasion.